Hello, everyone. So, I'm going to take you through all the questions that I did for my interview with my mom. She has chronic low back pain, and that's the general focus we're going to focus on is low back pain, how it correlates to depression and other biopsychosocial issues. So, the first question I asked her was, "How would you describe your low back pain in one word?" And she just responded with a simple that it's constant. So I was like, all right, that's fine. And then I asked her, is there any kind of activities that she's afraid to do since developing this low back pain? And she likes to garden, so bending over is very painful. Lifting heavy objects have been difficult for her. And then simply mopping the floor bent over is a difficult task for her to do. So little activities like that have been pretty restricting for her. Another thing that I asked her was if she's been experiencing any kind of depression since that back pain started. And she answered yes, but didn't really want to elaborate, so I respected it. So I continued on and asking, how would you describe your mental well-being at this moment? And she said that she always felt overwhelmed. She was always exhausted, and that she always felt anxious. And there was another thing that stood out to me is that she was almost fearful of life, fearful of going out and doing things because of her low back and how she felt anxious and how she would react to that. So then another thing we moved on to is I asked her, do you feel like anybody has treated you differently since this low back pain and emotional stress came on, like the onset of it? And she said yes, both her spouse, so my father, and her coworkers make little subtle jokes that they think are funny, but definitely dig deep down at her. One thing that is said very often is they joke around saying, oh, she's an old lady because her low back hurts. Obviously, it's something simple, but it bugs her. So it's definitely influenced her and how she feels. And then I said, how would you describe your experience with healthcare workers when discussing your low back pain and emotional stress? So initially, her PCP, all they wanted to do was immediately put her on antidepressants and then Tylenol. They wanted no other interventions. They didn't care to ask her any deeper questions. They immediately just wanted to give her medication, which she knew she didn't want because it's going to make her emotional state worse. But then she did end up getting into a chiropractor, which they definitely provided her with better care and gave her interventions such as stretching, manipulations, exercises, and it made her feel like she was actually being a priority to them rather than just giving her meds and sending her on her way. And then the last question I asked is that have you been able to gain access to services since this low back pain and emotional stresses came on? And initially she said no because the insurance she has causes her to have a high deductible and she just simply can't afford any kind of x-rays, treatments, anything along those lines. But then she did recently get into a car accident where she was rear-ended, and due to that she was able to get in and receive free care that was covered by insurance, and with that she was able to see the chiropractor who actually gave her better care and allowed her to somewhat get better.
So the first question we had was, how would you describe your low back pain using one word? And she said nagging. For number 2, what activities have you been afraid to do since developing this pain? She said going to the movies, car trips, walking, her exercise classes. And then she said she has experienced symptoms of depression since getting low back pain. And if she was to describe her mental well-being, she said frustrated. So with all these, you can kind of tell the mental effect it's having on her. In our family, we really like to go on trips and go to the movies and things like that. So not being able to do things she likes is obviously going to put some dampening on your happiness, as evidenced by her answers. Basically, it sounded like anything that would have her sitting for a prolonged period of time was just very hard for her. So you can kind of see how the pain in her back is keeping her from doing all the things that she enjoys to do. And if you can't do the things that you like to do, you're obviously going to experience some symptoms of depression, as she stated. And since I have a little bit of time, also, she said that acupuncture actually helped her a lot. So, I mean, she was able to kind of get the care that she needed and find something that worked for her. So, I think it's just important to help your patient find what works for them, and also just educate them on the mental aspect that goes along with this condition.
The first question we started off with was, how would you describe your low back pain using one word? And she described it as sporadic, because she feels like she has really good days where she's able to do more tasks, and then she has bad days where she's not able to do as much tasks as she wants to. The second question we went over was, what activities have you been afraid to do since developing this pain? We were really trying to see if she's having any fear avoidance. So she said she is afraid of doing tasks that involve her picking up things off the floor, bending over, doing stuff such as gardening, and she's fearful of this task because she just doesn't want to hurt herself even more. And so when she does these tasks, she tends to come back up slowly after bending over, just so that she can avoid hurting herself more. The next question we did was, have you experienced symptoms of depression since this low back pain started? And she said that she has. She feels like since this back pain has been going on for over a year, that it'll never get better. She feels like she can't do the things she needs to do around the house, especially since she's trying to trying to prepare her house for to be put on the market. She also can't go and enjoy the activities her family enjoys, such as doing activities that involve her bending over or exerting herself. The next question that we went over was, how would you describe your mental well-being? And she said she's frustrated by the pain that she has, and she's annoyed that she can't do the stuff around her house, and she can't do most fun activities. And then, of course, she's also fearful about doing these tasks because she doesn't want to hurt herself anymore. The next question we did was, do you feel people have treated you differently for having this low back pain and emotional stress? And she says that she hasn't specifically seen her family do it, or anyone that she knows treat her differently, but she feels like because she's not able to do these activities, that she's letting her family down. The next question we did was, how would you describe your experience with healthcare workers when discussing your low back pain and emotional stress? And she says that she has been given the attention she needs, and she feels like they want to solve her problem, but that's as far as her low back pain. When she talks about her emotional state, she says it feels like they brush it off, and they keep on telling her that her emotional state will get better once they fix her low back pain. And then the final question we went over was, have you been able to gain access to services to help with your low back pain and emotional stress? And she said yes, as far as her low back pain, she has been able to get services such as physical therapy, but she would really like to go to a chiropractor, but because of her insurance, deeming that chiropractor is not a medical service, they won't pay for her to go to a chiropractor. But as far as her emotional state, she hasn't been able to get the help because her doctor doesn't deem it necessary for her to go get help, so he won't refer her.
For our last patient interview, I interviewed my mother, who suffers from chronic low back pain, and she described her whole experience in one word as torture. She constantly felt like her body wouldn't allow her to do things, which limited her from doing daily activities like walking, doing any sort of exercising, or even going to the grocery store at times. She felt a lot of fear with doing any of those activities. In general, she does feel depressed since this has started, and she feels that people in the community have treated her differently. Not only do they pity her, but they don't understand overall what she has been going through. Her experience with the healthcare system, she said, was extremely frustrating. She had to jump through a countless number of obstacles and hoops just to get any sort of treatment, and with that, they just pumped her full of meds and steroid shots, and she felt like she could not get to the source of her issue. But since then, she has been able to get access to physical therapy after years of battling through hoops, and she found that she was able to find someone that could empathize with her condition and give her not only pain management, but decrease some of those mental health symptoms that she was having. So with that, in our literature review, we found that almost half of patients who present with chronic low back pain also present with symptoms of depression. And we found that with that, Fear avoidance leads to those activity limitations, which leads to low self-esteem with patients who suffer from depression as well. And that toll on that emotional stress can actually cause lower back pain to continually reoccur. And patients are just stuck in this never-ending battle. So overall, it's important to just provide that patient-centered care and be an advocate for your patient, and overall increase awareness for these psychosocial challenges.